As soon as you find out you're pregnant, you should call an OB provider and make your first appointment. And depending on when your last period was or whether or not you've had regular cycles, they'll decide when they want to see you. And if you've had a history of miscarriage or you've had previous high-risk pregnancies or you haven't had a period for forever, they may want to see you sooner rather than later to do an ultrasound to see how far along you are, because that's the most accurate way to date a pregnancy if you've been irregular. However, if you've had regular cycles and you don't have a high-risk history, then the doctor may not want to see you until closer to 12 weeks of pregnancy, because if things have gone well up to that point, you haven't had bleeding and you haven't had cramping, and you hear the heartbeat at that appointment, then the chances of miscarriage are way low at that point. It's important to make sure that the latest you see the doctor is 13 weeks and plan on about 13 appointments over the course of your pregnancy. At 20 weeks, it's normal for a doctor to do a routine ultrasound, and for some women, this is the only one they'll ever have. And the main objective of this ultrasound is to check the baby's growth and all of the organs and structures to make sure that the pregnancy is going well and that the baby has all of his or her vital organs. And of course, you also get to find out at this point if you're having a boy or a girl, and so that's exciting. If things are going well, then another ultrasound really isn't necessary. Prenatal care is so important because it helps to make sure that you and the baby are as healthy as possible. It helps the doctor to be proactive in your care and catch things before they turn into big issues, and hopefully, again, make sure that you and the baby are as healthy as possible. If you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/InterMountainMoms, and recommend us to your friends and family too.